Hi, everyone. My name is Olivia Rizzo. I'm a pulmonary and critical care medicine fellow in Cleveland, Ohio. I'm one of the 2024-2025 A. Jean Capello Health Advocacy Fellows, and I'm excited to present to you my Capstone project. My story starts when I was a little kid. My dad's a doctor, and I always wanted to be a doctor like him. I remember rounding with him on weekends sometimes, and although it was a little boring at the time, I loved being in the hospital and hanging out with my dad. When I was a little older, my parents got me Presidential Barbie, and this is where I shifted from wanting to be a doctor to wanting to be president. My parents always taught me that a girl could be president, and that girl could be me. I memorized the president's cabinet and proudly recited their names and roles when prompted by my parents. This is probably where I first got curious about politics. I circled back on wanting to be a doctor and went to medical school at Wayne State University School of Medicine in Detroit, Michigan. My very first patient, my cadaver in anatomy lab, taught me that medicine and politics are intertwined. She died of lung cancer, and when I Googled her zip code, this picture came up. A playground next to a highway next to the Detroit trash incinerator. I felt a strong sense of justice for her. She could have done everything right and gotten sick anyway because of where she was born. This sparked my passion for policy, but I wasn't sure where to start. I eventually found a way to learn about advocacy through Doctors for America. Through this fellowship, I joined the Public Health Task Force in the Community Health and Prevention Impact area. I learned the importance of storytelling through participating in the Vaccine Story Portal. I learned that a simple story that I would tell my friends can have a huge impact if I share it with the right audience, like policymakers or people who are skeptical about public health initiatives. I submitted a story of hope about the future of vaccines, as I reflected on the joy I felt when the first COVID vaccines were available, and I volunteered to administer them to people in Detroit. I learned that we all have stories to share, and these stories can make a difference. Through our monthly fellow meetings and attending advocacy grand rounds, I learned about the inner workings of our country's healthcare system and use that knowledge to collaborate with my co-residents to deliver a curriculum to residents about physician advocacy with a focus on health systems. I used the op-ed writing workshop I attended as a Capello Fellow to inspire an op-ed writing workshop that I delivered to my co-residents. I even facilitated a special grand rounds on planetary health, which was well received by my department. As a member of the Public Health Task Force, I collaborated with Doctors for America's summer policy intern, Kenzie Yates, on a comment in regard to Robert F. Kennedy Jr.'s request for public opinion on deregulation to make America healthy again. This was the first time I'd written something like this, and this was a unique mental exercise because doctors tend to like regulation. I was really happy with how this turned out, and I feel really proud that I learned how to do this and went out of my comfort zone to express my opinion in order to protect my patients. I would have never done this without the support and guidance of Doctors for America. The best thing I'm taking away from my year as a Capello Fellow is my new network. It feels great to have a cohort of fellows who I consider my friends. Some of them, like Colin Wilson, pictured here on the left, have become my friends in real life. I also got the confidence to reach out to my city councilman to inquire about how I could get involved in my local government. He was awesome, and I couldn't believe how nervous I was to call him when he turned out to be incredibly kind and helpful. He connected me with the director of the Cleveland Department of Public Health, who I'm planning to meet with in a few weeks to get involved in our local public health initiatives. I reread my application to this fellowship as I thought about what I wanted to say in this capstone presentation. I mentioned feeling lost with respect to how to get started just doing the work of getting involved in advocacy. I wanted to spread the word about Doctors for America and advocacy to my co-residents so they wouldn't feel lost like me. Looking back, I ended up facilitating 3 of my co-residents attending an advocacy training in Washington, D.C. I became the go-to person for advocacy in my program, and a few of my co-residents applied for the Capello Fellowship this year. Looking ahead, I think the future is bright. I joined a pulmonology and critical care fellowship where I'm supported in my passion for addressing the intersections of environmental health, climate change, and lung disease. I found a faculty member whose passions are the same as mine and could be a mentor for me. And most importantly, I now have a network where I can channel my policy and advocacy interests. I have some friends in local advocacy organizations, local government, and I have new friends locally and nationally who have similar experiences as me as a doctor interested in politics. All of these were the things I was dreaming of before I started this fellowship. I'd like to close by thanking the people who helped me get here. Our fearless leaders, Angie and May, Dr. A. Jean Capello and Doctors for America for giving me a space and community to channel my angst and energy, Dr. Rob Rizzo, who recommended I apply for this fellowship, Dr. Keith Armitage, my former program director, for supporting me in connecting my advocacy interests with medical education, my public health task force crew for creating my monthly therapy session, my co-residents and non-medicine friends for humoring all my endeavors and listening to me talk about politics all the time, and my parents who always made me feel like I could make a difference in the world. Being part of this fellowship was a total honor, and this is one of my proudest accomplishments.